Hello guys and welcome back to Medu. Today we are going to be covering cell adaptations. We are going to be covering only the part of hypertrophy in this lecture, and we'll be making some more parts for the other types of cell adaptations. So let's get right into it. So let's consider this circle as a normal cell in homeostasis. So when some stress is applied onto it, it results into it adapting, which is also called as cell adaptations. If the cell is unable to adapt, it results into a cellular injury. Now, these cell adaptations are of four types. Number one is hypertrophy. Number two is hyperplasia. Number three is atrophy. And number four is metaplasia. We are going to be covering all of these other types of cell adaptations in our next videos, so make sure you're subscribed for that. So when these cell adaptations, when the stress gets removed, the cell automatically turns back into a normal cell. Now let's move on to hypertrophy. Hypertrophy can be defined as the increase in size or of tissue or organ due to the increase in cell size. This can be due to the increased demand or workload of the cell. Now we are going to be looking into the types of hypertrophy. There are two types of hypertrophy. Number one is the physiological, and number two is pathological. Now, to better understand the physiological hypertrophy, let's take the very common example of it. Suppose you have gone to a gym and you are seeing these people weightlifting. What are they doing? They are actually exercising on purpose to cause hypertrophy in the muscles so that they look bigger. So we can write over here like physiological, it is the hypertrophy of skeletal muscles of the bodybuilders. Pathological hypertrophy can be seen in cardiac muscles and smooth muscles. So if we see the hypertrophy in cardiac muscles, it is due to the left ventricular hypertrophy, or also known as LVH. LVH is due to the damaged valves or also known as aortic stenosis. So what happens basically is, if you consider this as a heart, so if we consider that the valves are over here When these get damaged, it results into the increased filling of the left ventricle. So, due to the increased filling, these heart walls get stretched even more to the outside, which will cause it to contract with more force. Due to this prolonged contraction with more force over a long period of time, it results into hypertrophy. So if we now see the hypertrophy in the smooth muscle, it is most commonly seen in urinary bladders. So this hypertrophy occurs in response to the, the urethral obstruction. Also seen, for example, seen in prostate hyperplasia. So let's consider this as the urinary bladder. So consider a prostate to be here and it has somehow obstructed it. So what happens is that more urine gets accumulated over time. This causes the urinary bladder to expand more and thus results into hypertrophy. So now let's see the mechanism of hypertrophy. Well, mechanism of hypertrophy can be easily defined as the increased synthesis of cells or cellular proteins. So now, if we see in detail, there are three factors that are primarily responsible for hypertrophy. Number one are the growth factors. These include the TGF-B and the IGF-1. The second factor responsible is increased mechanical workload. And the third are hypertrophy agonists. Now, hypertrophy agonists include angiotensin 2, and nitric oxide. So, what happens is these factors together they cause the activation of signal transduction pathways. Now, the activation of these signal transduction pathways will result into the activation of transcription factors. Now, the activation of these transcription factors will result into three things. Number one is the increased production of growth factors. Number two is the induction of embryonic or fetal genes, for instance, ANF or anti-natriuretic factor. And third is the synthesis of contractile proteins. Now I understand that you guys may not understand what this basically does. So what happens is that ANF is actually expressed in embryonic heart. Only. This factor is not seen after birth of the child, but in a cardiac hypertrophy, this is seen again. So what this does is it, number one, decreases the workload, and number two is increases the mechanical performance. And both of them together help in decreasing blood pressure. So that is it for today, guys. I hope you guys enjoyed today's video. Make sure to leave a like, subscribe to the channel, and hit the bell icon to get notified when our new video releases.